Hi, and welcome to the next weekly report from the NEU on COVID cases following the wider opening of schools on the 8th of March. It's now 7 weeks since that wider opening of schools, and there is some good news in this recording. When we look at overall cases, you can see that this line continues to fall. That's very welcome. Cases are now, at the date that we're reporting here, 1 in 650 people have the virus. That is the same as at the 7th of September last year. Cases are now falling in all of the home nations. There was a concern in Scotland previously, and you can see on this graph that there is a slight increase in the blue line for Scotland following the wider opening of primary schools there in late September. But you can also see that that curve peaked and then began to fall actually before the Easter holidays. And there is some thought that it's vaccination overtaking the effects of wider opening. When we look at the cases in the English regions, they still vary, but nothing like the variation we had earlier in November and December, and all of them going in the right direction. It's still, though, the case that they're a lot higher in the northeast than in the southwest, so there are things to keep looking at in that data set. If you look at school ages specifically, the blue line here is that represents primary age children most specifically, although it is actually from age 2 to school year 6 from the Office of National Statistics. And you can see that the curve for that age group has declined sharply. And again, you can see, as I said around Scotland, you can see that the increase began around the time that schools opened, but the peak actually seems to us to indicate that cases might have just started to fall before the Easter holiday and then have gone down sharply as a result of the Easter holiday closure. Cases in primary schools are now at 1 in 540 pupils, and that's the same as at the 24th of September last year. The red line for secondary students does not show the same degree of decline. It shows some decline, but within the margin of error, that could still be flat. But they don't look like they're going up at the moment. There was that increase immediately before the Easter holiday. We want to see what happens as vaccination spreads and as restrictions are lifted. Lifting restrictions will tend to increase cases. Spreading vaccination will tend to decrease cases. We need to look at what happens across the next period and to do everything we can to stop cases rising. When we compare with all ages, it's good to see that primary cases are now down to the all age average. Secondary cases still a bit above there, and we will want to continue looking at that. Looking at lateral flow tests in the week of the 7th of March, that's on the dated from the Sunday, that's the week that schools opened. You can see more than 7 million tests were done. Those tests were done largely in school on secondary pupils. In the following weeks, they were conducted by parents at home, and they stayed up quite well, but there was that decline over Easter. And now the government is saying that any adult can get a lateral flow test. So we would like to see more of these. Now, lateral flow tests miss some cases, but they find some cases. And finding cases and then self-isolating keeps everyone safer. It's also true that with cases as low as they are now, quite a lot of positives from lateral flow tests will be false positive. But if you get a positive from the lateral flow, then you go and get a PCR test. So we would still end up finding some cases, and they would be good to find. This slide reports from a SAGE meeting that happened on the 8th of April. And in the first paragraph here, they're talking about the fact that the R rate is between 0.8 and 1, and therefore cases carrying on declining. In the second bit, and the bit that we've highlighted, this is from before the pandemic. It's just scientists saying that most contacts that you have are at work, or if you're a child, at school. And so how we behave at work and how we behave at school really matters. It's good that cases are falling. We need to keep them falling for as long as possible as the vaccination spreads. And from that point of view, from the NEU's point of view and understanding, that means that we should keep mask wearing running in schools until these trends are even more clear. We should be encouraging the use of lateral flow tests to find some asymptomatic cases. Even if it misses some, it still finds some and stops the spread. That ventilation continues to be really important. It gets easier towards the summer. It's really important to have windows open to ventilate classrooms as much as we can, to try and avoid using classrooms that can't be properly ventilated. We're still saying in-person staff meetings should not be happening. The in-person staff meeting is the place where you are most likely to contract coronavirus if you are a member of staff in a school. So we're saying at the current point, they should not be happening. The government doesn't think they should be happening either. And we're saying that clinically extremely vulnerable should work from home until they've had their second dose and built up proper antibodies for that second dose. Now, having said that, cases going down, we need to do everything we can to keep them going down. There is good news. This is the hospitalisation chart, and this chart shows exponential decline. It looks like it's getting flatter. It's getting flatter because that's how exponential change works. Actually, cases are continuing to fall of hospitalisation, and that's a very good news story. And the deaths data is also very positive. So we want to keep all these trends going in the right direction. We report regularly on the number of clusters and outbreaks in schools, but because we've had school closures for the last 2 weeks, there's very little data to report on. So I'm just leaving this there that you can see that pattern. We'll come back to it as schools, as we see the data of the effect of schools actually being open. This is a new chart for us. This shows the age-sex pyramid for the first dose of coronavirus. And looking at this chart at the top level here, from 80-year-olds and up, you can see that 95% of men, 95% of women have had their first dose of the virus. Slight drop off as you come down the age, but men, 50-year-old men, get your vaccine done. Only 80% of them have had their vaccine done. 85% of 50-year-old women have had it done. Men should look at that. You can now see that these dashed bars are the change that's happened this week on first doses, and it's now 45-year-olds who are getting their first dose, and the NEU emailed all of its 45-year-old members with the link to the booking website so that they can get booked up. Again, we see a slight reduction in men compared with women, and I'd urge all men to get their vaccine. On second doses, the checked bars here show that this is where most vaccination activity is at the moment. It is getting second doses done, and until they're done, it's going to be hard for the government or for the NHS to do more on first doses because we're up against that 12-week barrier. So it's now important that all those second doses are continued. The information today about AstraZeneca and Pfizer about the extremely high efficacy of the vaccine at not only stopping deaths and hospitalizations, but at stopping people getting even asymptomatic mild coronavirus, and therefore, obviously, if they don't get coronavirus, not able to transmit coronavirus. That data is very positive, and it says that vaccinating is not only good for you, but it is good for the others in your community. This is a new chart for us, and I'll just leave it there for a second. Our government in England is intending to spend far less on education recovery per child than the Netherlands, than the United States. And we think our government should look at that. That doesn't mean longer school days for education. It can mean smaller class sizes. It can mean more opportunities for sports outside school. We need to invest in our children's future. The NEU is continuing to maintain its COVID website, which reports on cases in your area. Keep a look on the cases around your school. Use it to remind yourself We want ventilation. We want masks. We want no in-person staff meetings. We want lateral flow tests to be conducted to find some of those asymptomatic cases. We're continuing to have advice on health and safety on our COVID website. Have a look at the video that we have about risk assessment and ventilation on that website. And we're continuing to work on the education recovery plan. Have a look at that website and have a look at the video from Kevin Collins talking about education recovery that we've got there. Thanks for listening and see you again next week.